Hello and welcome to ITERS Item 31. This item is about scheduling and transitions. And in this short video and presentation, we're going to look at ITERS, the Infant and Toddler Environmental Rating Scale, Item 31. And of course, ITERS is a rating scale for early years classrooms or settings where you look at different aspects of the early years environment and rate it between inadequate being a rating scale 1 and excellent being a rating scale 7. So what we're going to do in this presentation is we're going to start off by looking at some of Sammy's top tips for scheduling and transitioning in an early years 0 to 3 classroom. And then we're going to go on to look at the indicators, the criteria for an inadequate rating, which would be 1. If you meet any of the inadequates, you're coming out at a rating of 1 according to ITERS. Then we'll be looking at minimal, which is, the bare minimum that you would be doing in order to achieve this standard. And that is a grade 3. And we'll be going on to look at a good at 5 and excellent at 7. So we'll be looking at the criteria in each of those categories. So let's dive in and start looking at some of Sammy's top tips. So here we go. This is my top tip number 1 for transitions. Try to avoid hard transitions and keep the flow of the room or the early years setting wherever you can. So what I mean by that is rather than stopping everyone stop, everyone to the door, everyone outside, everyone to the lunch table. Try and do it more gradually with 1, 2 children as they naturally come to an end of what they're doing. Flexibly move them on to the next task or the next transition, out to the garden, off to lunch, wash hands. Try to avoid what I refer to as hard transitions. Okay, try to make transition times fun. Use songs or rhymes. If your name is Sammy, please stand up, turn around, wash your hands and go to lunch. Tidy up songs. Off we go to the garden songs. Off we go. Off we go. Creating songs and rhymes that punctuate the day and highlight transitions can help children both to predict what's coming and reduce the stress of moving from one thing, from one area, from one engagement to another. My massive top tip number 3 is to reduce transitions. Have a look at your schedule and really think if each transition that you do during the day is necessary, and look at ways to, wherever you can, reduce the number of transitions that you're moving children through during the day. That will really help with children's sense of security. Avoiding moving children from space to space will also help the staff stress, etc. as well. My top tip number 4 is one of my big mantras in early years. No waiting. Children should not be asked to wait. We're not trying to teach children patience or waiting skills. That is not a skill that we need to be teaching children. And asking them to wait for things is not a way to support the development of patience either. And it's certainly not age appropriate, and certainly not when we're thinking about children 0 to 3. So when they come to the table to start eating, their food needs to be there. It needs to be ready. They need to be able to start straight away, not wait for you to go and get the food, wait for you to serve each person. Imagine if they're the 10th child to be served. They can't wait that long. If you're waiting at the door for everyone to gather, no, have one member of staff start to take the children where they need to go and the rest will follow. Just cut out waiting for children. It's bad practice, it's not needed, and it's not necessary. So just plan your day, plan your sessions to reduce or eradicate, even better, waiting. My fifth top tip is about having a plan. Have a plan. When you're going to a transition where you're moving children, have a plan. Where do you want them to go? What do you want them to do? So don't stop all the children and then think about what you need them to do or where you want them to go, or you want them to move to a space that's not yet ready. Have a plan, prepare properly, know where you want the children to go and know what you want them to do, and communicate that clearly. And my last top tip is be flexible. Be flexible with the schedule, be flexible with the transitions. Try to support children's own individual needs. So if a child's still playing and not yet ready to transition, let them continue, let their play come to a natural end. If a child is already finished or wandering around and not engaged in something right now, choose that child to do toileting with rather than the child that's on the top of your toileting list because you want to do it in alphabetical order. No, read the room. Be flexible with all of your routines and all of your transitions to really look at the children's needs and think about how you can meet their needs, and be flexible with everything that's planned in a way that enables you to be responsive to children's needs. Responsive caregiving is really up there with excellent practice. It's not about having no plan, having chaos and just letting things, of course, have a plan, have a routine, have predictability, but be flexible with that so that you can really meet children's needs. Okay, let's jump in and let's look at the inadequate criteria for ITERS Item 31, scheduling and transitioning. So here we go. These are the criteria. If you meet any of these criteria, even one of them, then you are coming out at a grade 1 or rating 1, which is inadequate. Okay, so even if you meet some of the later criteria, you still can't progress past a 1. Okay, so let's have a look now at what these criteria are. So the schedule is either too rigid, so it's not satisfying the needs of the children, or it's too flexible, chaotic, and lacking some kind of dependable sequence of daily events. So if you're doing either of those two things, too rigid or too chaotic, then you are coming out as inadequate. Criteria 2, transitions are usually chaotic. Okay, so for example, that might mean children are wandering around aimlessly, they're left in a restrictive area for long periods of time. If that describes your usual approach to transitions, then you are inadequate and you must make changes. Staff are usually not prepared for what is coming next in the schedule. So that means that you stop something and you're not prepared for the next thing, and you're kind of trying to prepare on the hoof. If that describes your practice or what goes on in your early years classroom, that is inadequate. Staff usually do not provide adequate supervision. So that might mean that staff are too busy trying to kind of organise things and maybe have their back turned to children while they're working on something on the worktop, and during the schedule and transitions, they're providing inadequate supervision. So if that describes your classroom practice and what goes on in your classroom, you are coming out at a number 1 on the ITES scale and inadequate. And finally, children are required to wait for 10 minutes or more during transitions with nothing engaging to do. So That might mean that children are sitting at a table waiting for the next activity for a long time. Babies might be left in their beds while they're waiting to have their nappies changed. I mentioned, waiting for food before. Any of those things, if you're waiting for long periods of time, for example, 10 minutes, I think 10 minutes is an excruciatingly long period of time for a small child to wait. And if that's happening, you're coming out at inadequate. Okay, let's skip on to the next slide and let's look at the minimal criteria. So this is a number 3, or if you're doing, there's 4 of these. So if you're doing at least 2 of these, but not the other 2, then you're coming out at a number 2. So providing you've not met any of the inadequate criteria, then you can start to look at these minimal criteria. So minimally, the schedule meets the needs of most of the children in the classroom or the early years setting. Staff usually provide enough supervision with only a few problems occurring during transitions. Problem might be a child not coming along with the rest of them, might be waiting a bit too long, a hiccup in terms of not really knowing or understanding where you should go. Usually that doesn't happen, but sometimes there may be a few problems with those things. If that's happening, you're coming out at a minimal. This is a rating number 3. Staff are prepared for the next activity in at least half of all transitions, and active and quiet play are varied to meet the children's needs. So those are your minimal criteria for scheduling and for transitions. So moving on, this is what is happening in your early years setting if you are good. So you must, as a minimum, meet the minimal criteria. And then if you're meeting 2 of these, you're coming out at a 4. And if you're meeting all 3 of these, you're coming out at a 5. Okay, so transitions are often gradual or individualized. That's good. Staff are almost always prepared for the next activity, for what's coming next. So if you're moving children to a nappy changing or toileting phase of the day, you've pre-prepared the area. The things that you need for nappy changing and toileting are already there. They're sorted, they're out. If you're moving children to the garden is already prepared. You know the route you're taking to the garden, and children can come into that space immediately and begin playing and engaging with the materials and resources that you've set out. And the third criteria here, that there's no negative staff-child interactions seen throughout transitions. Stop doing that! Quick, come faster. I told you not to do that. No, come on, yalla, let's move. We're not seeing those kind of things. We're seeing positive, encouraging tones and language with the children throughout transitions. Okay, so if you're meeting 2 of these, you're coming out at a number 4. And if you're meeting all 3 of these, you're coming out at a rating of good, which is a scale number 5. And let's go on and look at excellent. So if you're meeting all of these excellent criteria, you're coming out at a rating of a 7. And if you're meeting all of the goods, all of the minimals, and 2 of these, then you are coming out at a rating of a 6. So 2 of these, a 6, all 3 of these, a 7. Let's have a look at the criteria then. Staff adjust the schedule of play activities throughout the day to meet the varying needs of children. And those adjustments are smooth, they're child-centered, they're not harsh, and they're done in a way that really does support children's individual needs. Transitions from one time of the day to the next time of the day, from one space to another space. These are usually smooth, and waiting time with nothing to engage the children never exceeds 3 minutes. I even think 3 minutes is long. So really no to minimal waiting time, with an absolute maximum cap on waiting time of 3 minutes. So if you're doing all three of these things and all your goods, you're coming out at a level 7. And if you're not doing all of these things, have a look, see what you can do in order to change, to adapt, not just your practice, but also the schedule. How can you make the divide between one part of the day and the next part of the day a bit softer, a bit more rounded? And rather than stopping everyone, how can you do that gradually? So do have a look through these standards and think about how you can take steps towards excellence. Strive for excellence. That's what the ITERS is all about.